Hello and welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm real glad that you could join us again. Going to be speaking with returning guest Dr. Richard Shane this evening, co-founder and chief clinical officer of Sleep Easy. He's joining us to talk about the new Sleep Easy mobile app that was recently launched. It's based on his proven methodology of neurosomatic patterning for sleep. Welcome back to Health Professional Radio, Richard Shane. Thanks for joining us again.
Thank you very much, Neil, for having me.
Now, I did, of course, mention that you have a specific methodology when it comes to sleep and sleep hygiene. And I also mentioned that you're a returning guest. For our listeners who may not be familiar with you when you were here before, give us a little bit of your professional background and talk about your role there as co-founder and chief clinical officer of Sleep Easy.
Okay, Neil. So since 2009, I've been a behavioral sleep therapist for one of the largest primary care practices in Colorado, which serves over 200,000 patients. And in a published clinical study, the Sleep Easy method was used by United Airlines pilots, police, firefighters, and the general public, and 81.6% of participants reported they slept better, and the vast majority reported their sleep began to improve their first night or within the first few nights. And my work's been featured in over 100 publications and journals, including Men's Health, Shape, Dr. Oz, The Good Life, and I'm a sleep expert and monthly contributor to Psychology Today. I've also worked with many corporations, including United Airlines, Hewlett-Packard, and Ball Aerospace. And Neil, how this method came to be, which makes it different from all other sleep methods, is I've been a psychotherapist for decades, and then years ago, as a result of a major life crisis, I developed severe insomnia. And then I took it on as a mission to explore within myself to discover how sleep happens. And so from years of exploration, combined with years of research and clinical practice, I made a major discovery that's an important contribution to the field of sleep medicine, and that is there are several body sensations that when you feel them in a very simple way, it creates the body feeling of falling asleep or falling back to sleep. And so with this method, you don't have to try to calm your mind or emotions, because that's what blocks people usually. With this, instead, in the midst of whatever's going on in your mind and emotions, when you feel these body sensations of sleep, mind and emotions become calm by themselves.
These are body sensations that you say need to be put together, or can they be experienced separately at any given time during the night when you're trying to sleep?
Well, there are actually just very few of them, and they blend together into the body feeling of falling asleep. And they're so simple, you use them together. It's very simple.
Now, why is this relative as far as sleep is concerned, particularly to health professionals?
Well, Neil, before COVID, it was estimated that 70 million Americans had frequent sleep problems. And since COVID, it's estimated that now over 100 million Americans have frequent sleep problems. And then you add to that the election turmoil and social unrest. We are in the midst of an epidemic of sleep difficulties. And what's so important about sleep is poor sleep has a damaging effect on almost every area of life. And conversely, good sleep has a positive effect on almost every area of life. So good sleep truly is life-changing. And then of special interest to the healthcare professionals listening to your program is that about their patients, research shows that when people sleep poorly, that impairs immune system functioning, increases risk for cardiovascular disease, weight gain, and inflammation. And so when your listeners' patients sleep better, they're going to respond more effectively to all the treatments that your practitioners offer them. And one last piece of interest for your listeners is research published in the Journal of American Medical Association shows that 29% of healthcare professionals have at least one sleep disorder, which greatly increases the risk of burnout.
Now, you mentioned that you had severe insomnia. When you're talking about sleep disorders, you mentioned multiple. What would you say are some of the most common sleep issues?
The most common are insomnia, and even in that, I prefer to not call it insomnia because most people have this misunderstanding that insomnia means hardly sleeping at all. And a lot of people will say, well, I don't have insomnia. I wake up too early and I can't fall back to sleep. So it's really the three main complaints are difficulty falling asleep, or waking up too early, having difficulty falling back to sleep, or when people don't sleep deeply. And then the other physical cause that's very prevalent is sleep apnea.
That's a big one, yeah.
Mm-hmm.
Well, let's talk about this app that Sleep Easy has developed.
Well, so for years, because this method has been so clear and simple, and it doesn't involve anything mysterious, in addition to working with clients, I've had this long-term vision to create a learn-at-home program to help people nationwide and worldwide sleep well. And after 20 years of research and development in my clinical practice, I'm excited to announce we launched the Sleep Easy mobile app, and that delivers this program so millions of people can sleep well and experience how that benefits almost all areas of life. And our company's motto is transforming people's lives one night at a time. And, when media addresses sleep, there's so much talk about sleep, but mostly what people talk about is either the importance of sleep or about sleep hygiene, the behaviors that support good sleep. They're helpful, but they're not usually enough. And almost all other apps and methods, what they do is they're taking traditional relaxation methods, trying to apply them to sleep. So relax your entire body, breathe deeply, count your breaths, visualization, meditation. Sleep Easy doesn't utilize any of those. It's easier than all of that. And people report that this feels like the way sleep naturally happens, not like an artificial technique.
So how does the app work?
Well, I'm just wondering if you have sometimes experienced difficulty sleeping yourself.
Well, yeah, actually I have.
So then what I'd like to do is to give you and your listeners something different, to actually guide your listeners through a few simple steps from the Sleep Easy app that'll make it possible for people to use easily to approach and actually cross over the threshold into sleep tonight, to fall asleep or back to sleep more easily. And this guided process will be very brief. Would that be okay with you?
Sure. Yeah, I'm looking forward to it.
So for everybody who's listening, I'm going to guide you through a few simple steps. And if you can, close your eyes. This will be brief. And just experience these easy steps as I talk to you. However, if you are driving, do not use these now. So here we go. So just close your eyes for a moment. And many people press their tongue against the roof of their mouth or their teeth, kind of like bracing against stress. So right now, if your tongue is pressed against the roof of your mouth or your teeth, allow your tongue to relax and feel softer. And if your tongue's not pressing, just allow it to relax a little more. And it can rest anywhere in your mouth, even lightly touching the roof of your mouth or your upper or lower teeth, just not pressing. And as you continue to do that, allow your throat to have the feeling that happens when you yawn. Your throat can begin to feel more open. Kind of the inside of your lower throat can begin to feel softer. And if your tongue or throat get tense again, just allow them to relax. Relaxing your tongue and throat helps your jaw and neck begin to relax. And the next small step is just, as you just breathe regularly, without changing your breath, gently feel the rise and fall of your chest and abdomen. And this helps you begin to sense the feeling of your breath moving inside your chest and abdomen. I'll pause for a moment so you can feel that, and then I'll finish up. Now, as you exhale, not the air moving out of your nose or mouth, but as you exhale, your chest moves inward toward deep in your chest, that feeling, softly flowing comfort, deep into your chest, the area of your heart. And then your mind likes that feeling of calmness deep in your chest. And your mind can rest in that feeling like resting on a soft pillow inside you. Mind softly resting in calmness deep in your chest. It's a feeling of having your awareness inside you, protected and safe, away from the things you usually think about. Mind and emotions become quieter, calmer. And as you use this a little while longer on your own, gradually ease closer to sleep. So just give yourself whatever time you want, and then open your eyes. And Neil, that's just a small part of the method, but can give your listeners a sense of how it's unlike other sleep methods. It's easier.
Well, I would really like to know where to get some more information, where to download the app. Is it a free app? I'm sure that it's compatible with both Android and iPhone.
So at Sleep Easy, we've developed a number of ways to help you. You can download the Sleep Easy app and try it for free at the Apple App Store. And if you want the Android version, I'll mention the website in a moment. We also offer individualized one-to-one programs. And to find out more or to schedule a free sleep consultation, you can visit us at sleepeasymethod.com.
Well, as always, it's been a pleasure speaking with you. Lots of great information and another great development that we can take advantage of to improve our sleep hygiene.
Neil, I thank you so much for having me on your show to share this with your listeners.
Well, Richard, thanks for coming back this evening. Always a pleasure, and I'm looking forward to our next conversation.
Okay, you be well and have a healthy and safe New Year.
You do the same.
Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Richard Shane. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.